Okay, great. Welcome, everyone. My name is Sandy Tipke. I'm the Executive Director of Foundation for Healthy North Dakota, and I'm excited to have everyone here today to kick off our Grandparents for Vaccines North Dakota chapter. And so the Foundation's mission is for Healthy North Dakota promotes health and wellness by empowering communities, families, and individuals to build a healthier North Dakota. We were founded in 2022, and we serve 53 counties within North Dakota. And then housekeeping, I'm going to introduce our speakers today, and everyone will be muted until after. And if you have any questions, just put them in the chat box and we'll work on those after the presentations. And we'll send a link to the recording, and there'll be an evaluation attached. So that's for housekeeping. And so next, I'm going to introduce speakers. Right today we have Dr. Donna Gaffney, who's the Board Vice President of Events for Grandparents for Vaccines, and then Teri Mills, who's the Board Vice President of Media for Grandparents for Vaccines, and then Kylie Hall, who's the Operations Director for the Center for Immunization Research and Education at North Dakota State University. So welcome, everyone, and can you all give a brief introduction before we present? Either Donna, Teri, or Kylie. Just give a brief background.
I'll start. My name is Donna Gaffney, and I am an advanced practice psych mental health nurse and doctorally prepared in research. And I am very excited about our organization because it really gives voice to a very important group of people who can really change the lives of our grandchildren, children everywhere. Teri?
I'm Teri Mills. I'm out here in Oregon, and it's raining, of course. And I'm a longtime nurse educator, now retired, and also worked many years as a nurse practitioner, primarily in the public health arena. And I am really excited too to be a part of Grandparents for Vaccines because I know that there's no greater love than a grandparent has for their grandkids. And there's no way we would put our grandkids in harm. So why would we recommend a vaccine if that was going to harm our kids? And we're just really happy to be here. So thank you for having us.
Hi, everyone. Kylie Hall. I work at North Dakota State University in Fargo in the Center for Immunization Research and Education. I've been here since our inception almost 11 years ago. I've done a lot of vaccine education and research work across the state of North Dakota. I'm also a lifelong North Dakotan, and my ties to North Dakota run deep, and I care deeply about the state and the people who live here. And I want them to all be protected from vaccine-preventable diseases, which is one of the reasons that I love my job. I get to talk about vaccines every day, all day. And so just really happy to be here and share the stage with Teri and Donna.
Great. Thanks, everyone. Why don't we get started with the presentations?
Great. Okay, so I am going to share and okay, how's that? Can everyone see?
Yes.
Great, great. So Teri and I are going to tag team this presentation, but certainly if you have any questions, please put them in the chat and we will get to them. So this is me with two of my five grandkids, and it was Halloween, you might notice, for them. Anyway, this is it's so important to talk about the conversations that we have with our grandkids and with their parents. And that's really what this organization is all about, which we will describe to you. This is Arthur Lavin, a retired pediatrician and founder for Grandparents for Vaccines. He roped us in and said, we want to do this. And it began to take on a life of its own, as we will share with you. So, Teri, I want you to just jump in when it's your slide because I can't see who's presenting when.
Okay.
These are some of the reasons why grandparents for vaccines is so important. Grandparents' voices are deeply trusted. We have relatable, lived experiences and stories, and we can connect across the generations. And our core beliefs, we believe the time to act is now. And we certainly saw that in September when we first launched our organization. And lived experience is powerful, it is persuasive, and trusted voices can shape public conversation. At a time when trust is at a premium, we really believe this is true. And when we think about the key elements of the power of our stories, storytelling is such a profoundly effective tool. We know that these are why our story is important. Vaccines are among public health's greatest contributions and achievement. We are, as grandparents and aunts and uncles and allies, trusted messengers. Stories are grounded in lived experience compared with credible facts. We are not just sharing our opinions, everything that we say is based in fact. And protecting children today certainly helps safeguard the health of our future. Sharing these stories can encourage vaccinations among hesitant parents, and we certainly hope that maybe the voices of our grandchildren will help to promote that encouragement among their parents. And this is who we are. Danielle, who is not on the call today, is our social media person, and we've had some remarkable social media coverage over the past 6 months, I'm sorry. And this is our executive director, and I'm going to play this. I'm hoping the audio comes through.
The audio is not coming through.
Okay, so I think there's probably a setting that we have to do, but I don't know which one that is. I don't know if any of you know that is, but let me just tell you a little bit about Kim. She is joined our group as a volunteer for the state of New Jersey. And when we began to get bigger and bigger and said we need help to deal with all of these exploding membership and media coverage and events, we knew that it was time for an executive director. So we started in September, and Kimberly was just hired. She expressed to us her interest in becoming an executive director. She has had an extraordinary career and knows exactly what it means to be an executive director. And she began just a few weeks ago. I think it was February 9th. So we are thrilled to have her here.
Donna, I'm going to take over, and I'm wondering if it's okay if I try to share my screen because I have a lot of audio in mine, and I want to see if the audio will come through.
The,
So,
I think the audio only comes through if it's set in a share one of those settings for the people who are hosting. I think so.
can we try?
Sure.
Can we? Okay, let's see if it'll work.
So I'm going to stop share.
Yeah. Okay. So let's see. Here's the current slide. Let me just whip through these just for a second. I just wanted to back up to the leadership team just for a second because I think it's important for you to all know, like, this is our leader team, but really every grandparent who signs up, we try to convince them to join our leadership team because we feel like every grandparent is a leader in their own right. And the whole idea of grandparents for vaccines is really to get every grandparent, all 67 million of us, talking about what life was like for us in what some people call the bad times or the before we had the pre-vaccine era. And we're kind of the last generation to have those stories. And unfortunately, because we all vaccinated our kids because we knew how bad it was, they're not really seeing what life was like or what could happen if they don't vaccinate. So right now we do have 57 state leaders. Sandy is one of them, Sandy Tipke. Thank you, Sandy. And they represent 26 states. But we are looking for more leaders in every state. So I'm just going to see, let me see if this video will.
I'm Kim from New Jersey.
Can you hear it?
I'm the executive director of a rapidly growing
Yes.
nonprofit, Grandparents for Vaccines. I was drawn to the organization as a volunteer because I am so committed to the mission, which is for grandparents to tell their stories of the time before vaccines. We're looking to change the national conversation about vaccines. Please join us at grandparentsforvaccines.com.
So, what does this slide have to do with anything that we're talking about today? Well, I love to introduce myself like this. This is actually a picture of myself with my identical twin. And when we were 4 years old, she always wanted our dolls to go to school and study math, but I had other ideas. So I guess I already knew about the measles when I was 4, and I borrowed my mom's lipstick, gave them the measles, and sent them directly to the doll hospital. And I think I knew when I was 4 years old that I wanted to be a nurse. And so the rest is kind of history. But my most favorite role of all is being Nona to my 2 grandkids. So we use the power of the media to, right now, what we're trying to do is build up our organization and let others know that Grandparents for Vaccines exist. So what we do is we share our real stories, and we also offer ready-to-use resources that others can share. And we really try to focus on positive conversations. We have graphics, we have quotes, we've written op-eds, we have presentation snippets, we have blurbs that you can put in your newsletter. As you can see, we're just trying really hard to branch out into the communities. And because we're trusted messengers, we have a lot of emotion-rich content that can effectively challenge misinformation without amplifying that misinformation. So we are on every social media platform, and our website is really easy to find. You can find it 2 ways. You could go to grandparentsforvaccines.com or grandparentsforvaccines.org. Either one will get you there. At the bottom of every page are links to every social media platform. And we're very fortunate because we do have some younger members who are not grandparents, obviously, but they know how to use social media, including some Ohio State University medical students who are kind of running our TikTok channel. And that is gradually growing. But our main thing for the media is our YouTube channel. So we have collected now about 48 stories or so that are on Grandparents for Vaccines YouTube channel. And again, you can find that very easily. Just Google Grandparents for Vaccines YouTube or go to our website, and you can watch some of the stories. And we wanted to play one of those for you today.
My name is Janice Flood Nichols. I'm a wife, a mother, a grandmother, a polio survivor, a polio pioneer, a medical counselor, and a vaccine advocate. I'm going to spend just a few minutes telling you about a time in our country that many people in my generation call the bad old days, the days before we had many vaccines for childhood diseases. My twin brother Frankie and I were in first grade. It was fall, and we were getting ready to go out Halloweening with our friends. Frankie had developed a little head cold a few days before Halloween, so my parents kept him home to make sure that he would be ready to go out Halloweening that weekend. But the day before Halloween, Frankie developed a terrible time breathing. My parents rushed him to City Hospital in Syracuse for communicable diseases. He was given a diagnostic spinal tap and immediately placed in an iron lung. By the next morning, his diagnosis had been confirmed. Frankie had polio. I was brought to the same hospital and given massive doses of gamma globulin, given up and down both arms and legs and the standard wet in the buttocks. It was the only thing that they knew that could sometimes prevent a case. By the next day, Frankie's condition had deteriorated even more. They could not control his secretions, so they decided to bring him to the operating room where they would perform an emergency tracheostomy. But Frankie died on the way to the operating room. It was November 1st, 1953 at 10:25 at night. In my faith, it's All Saints Day. I decided and told my parents that I was going to go to every part of his wake, to his funeral mass, and even to his burial at the cemetery. I had never been away from Frankie for 1 minute, and I was not about to be away from him now. But that night, I developed symptoms of polio, and I deteriorated very rapidly. So my parents rushed me off to the same hospital where Frankie had died a few days before. The doctors told my parents that they really did not know whether I was going to live or die. A few days later, my mother suffered a miscarriage. 4 days after admission to the hospital, I woke up. I couldn't move, but I was too young and innocent to really understand what all of that meant. But I heard a baby coughing incessantly down the hall. I had never heard a cough like that, and I eventually learned that that baby had whooping cough. I have spent my whole life wondering whether that little baby lived or died from a disease that we now can prevent through vaccination. My rehab began the day that I woke up in the hospital. And soon, by the spring of 1954, just as I was beginning to kind of walk a little bit again, I was given an opportunity to be in the Jonas Salk polio vaccine trial. To this day, it remains the largest vaccine trial in the history of the world. I was one of just under 2 million children in first, second, and third grade from the United States, Canada, and Finland. We were called polio pioneers. We were told we were doing something not only for our own generation, but for all future generations. Our parents must have been very afraid to have us participate in a new vaccine trial, but they knew that they could not do anything that was going to prolong the terrible, terrible surge of polio. Thankfully, because of that vaccine, the United States was declared polio-free of the wild virus in late 1970s, but polio is still not eradicated worldwide. I speak to you today as a woman who lost her twin, who lost 2 of my friends from that terrible epidemic, who can still recall that little baby in the hospital, who had a friend in graduate school who was deaf from the measles, and the story of a woman that I met when we moved to the Pacific Northwest who told me about her little sister who died from chickenpox pneumonia, something that we now have not only a vaccine for, but antibiotics that can lessen such a case. I ask you to please talk to other grandparents. We all have stories, and believe me, this is so hard for me to even talk about over 70 years later than the day that I lost my twin. I want you to speak to professionals who can tell you the importance of vaccinating for all of the childhood diseases. Do not believe it when people tell you that these diseases are just simple rites of passage. They all have the ability to kill and maim. My twin brother and I were rambunctious, healthy children. My parents did everything imaginable to protect us. But nothing was going to protect us if polio found our community before the polio vaccine was made available. Please listen to people, ponder, but please vaccinate your children. We cannot go back to these bad old days.
So Grandparents for Vaccines has actually been in a lot of media, national media, local media, statewide media since we launched. And we do have our appearances and interviews linked in the news page of our website. But if you are interested in doing a story, I know Hannah interviewed Dr. Lavin and myself for North Dakota. We're happy to help you. We do have pitches, we have fact sheets, we have a lot of information, and all you would need to do is send us an email at hello@grandparentsforvaccines.com, and we'll help you out. So again, we have a lot of trained grandparents, spokespeople for interviews. We also have interview logos, we have pitches, we have press releases, and we also have fact sheets. In the beginning, we weren't going to really get into the medical or nursing side when we were interviewed. We were going to try to focus on being a grandparent. However, we have evolved because, of course, you're seeing a huge rise in measles and in pertussis and in flu. And now a meningitis case was just reported at Kent State last week. And we're just really fearful with changes that are being made by the government that are really going to impact our grandkids. So we just sort of like go back and forth, like now we're a grandparent or now we're a nurse or a physician. We do have story-driven videos. You just saw one. We're trying to collect more videos from diverse communities and also in different languages. And we can definitely support rapid response messaging. We have put out several press releases, and those are also linked in the media. This is actually the article that was published by Foundation for a Healthy North Dakota, and then included in your newsletter and shared on social media. And that's how we amplify our message. And then this was just a quick little video that we wanted to show you today of one of those news media stations that picked up Grandparents for Vaccines. So
Joy, always great to hear from you. Thank you very much. We'll talk soon. All right, Heartland Health Department, one of the latest to join a national movement led by grandparents. Southern Health Department is now partnering with the organization Grandparents for Vaccines with a goal of changing the conversation around vaccines by passing down their knowledge and stories.
Extraordinary stories that these people now, seniors are carrying with them for the rest of their lives. And those are the stories we need to share, not just the joyous ones about thank goodness vaccines are here, but this is what happened when there were no vaccines. We call it the before times. It's very frightening and scary.
Co-founder Donna Gaffney, you heard her there, say after the project launched on September 7th, which was also Grandparents' Day, thousands of grandparents responded in the first 48 hours asking to join the movement. We are so happy to have Shauna Ryan with Southern Health Department live in the studio with us today. How are you?
Good. Thank you for having us come in and talk.
Yes, and thank you so much for taking the time to be here. You were just hearing our guest there speak. What goes through your head?
Oh, well, first off, Southern Health Department is so proud to be part of this effort. The Grandparents for Vaccines are a volunteer-led organization made up of grandparents and non-grandparents who are making it their mission to tell their life story before vaccines. And so we're very excited to be a part of that.
So what's the why behind why this is happening?
Well, we've talked before about how we are seeing an increase in vaccine-preventable diseases in our region. We've got measles throughout the nation. We've had rubella. We are seeing polio and others pop back up. So what this is doing is giving us an opportunity to talk to those parents and who are either vaccine hesitant or who've chosen not to get vaccinated for whatever reason, or maybe you're off your child's vaccine schedule. But this comes at a time where they're getting all kinds of information, a lot of misleading information, inaccurate information.
And oftentimes the word vaccine can be quite divisive in our country. And in your line of work, I want to know as well, if grandparents are watching this, what can they do to take part?
Well, they can always contact us at Southern 7 Health Department. We do invite them to visit the grandparentsforvaccines.com website. All the information is right there if they want to share their story. And if you want to kind of see what other grandparents are doing, check out their YouTube channel and get information there as well. But it's very easy to do. You can record this on your phone if you want to record your life story, or if you just want to write it down and send it to us, we'll make sure it gets shared.
And I can assume you've heard a couple of these stories. I mean, what's it like hearing them?
Well, I tell you what, for someone, the only preventable disease that I saw was chickenpox. I had chickenpox as a child.
Mm-hmm.
But to hear these grandparents talk about their own experience with polio and how different diseases impacted their families and their communities, it really brings it to life for a generation of people who've never seen any of this before. And that's the big takeaway from this. Most of the people who have children today have never had any childhood, virus or disease because they're vaccinated. And that's what this is all about, making sure that they're aware of those.
And I mean, hearing these stories too, I can assume can be so impactful. Do you oftentimes hear from folks that you're speaking to that, wow, their eyes are open to a different world?
Yeah, to talk to a young person about what an iron lung is in the treatment of polio, or how mumps can sometimes cause you to become infertile. It's like, okay, hold on a second, what? So it does. It really opens their eyes to it. And grandparents are people that we trust. If we take that opportunity to learn about their history and their background, talk with them during the holidays that are coming up, find out what their life was like before vaccines, it really makes an impact.
Well, Shauna, we always appreciate you talking to us here on Heartland Afternoon. You're a blast to have in the studio. Thank you.
Thank you. We appreciate it.
All right, we're going to send things over. Joe.
Thanks, Teri. So those were just two brief examples of how we can form partnerships with different organizations. What we're doing here today is exactly that very same thing. We want to collaborate with city, county, and state organizations, health departments, hospital systems, coalitions, and other nonprofit partners as well. The opportunities are endless, actually. And we've even had some requests to come to churches, to come to farmers markets. So there's a lot that we can do. Next, Teri. Now, when some of the things that we are, the events that we've covered is on our events page. And we participate, as I said, in all levels of organizational and governmental levels. And again, it's about sharing this lived experience. We're not going in and promoting a particular political agenda, but we want to introduce people to these individuals, these grandparents who have a story to tell. And again, if you are interested, we urge you to contact us at hello@grandparentsforvaccines.com. Next, please. Okay. So how do you take action? Join us, for one thing. And when you join, there will be an automatic pop-up that comes onto your screen. Fill it out. It goes directly to us and goes directly to our mailing list. And we have had 2 newsletters published. And if you join us and say, I didn't get any of those previous newsletters, we'll make sure that you get those past newsletters. The most recent one was in January. And share your story. The directions for making YouTube video are available. We can help with that. It's always great to do it right on your phone. Advocate for the American Academy of Pediatrics immunization schedule. When people say, well, who should I believe? What should I believe? That's what they should be believing. Organize local conversations via an event. Large or small, it doesn't matter. We want people to begin to share this news. And step into leadership. We would love to have you become one of our state leaders. Now, when you visit grandparents for vaccines, actually, we're going to, sorry, I think I'm a little out of sync here. Questions and answers. Okay. So what kinds of questions do you have? You can pop them into the chat. How can we make this easy for you? And also, what stories do you have to tell? What conversations have you had with other people, whether they're friends and colleagues your age or in your part of life? Or what about people who you want to convince and share with that information? How do you have these tough conversations maybe with your own kids? Teri?
Yeah, be sure and put questions in the chat. We'd love to know what you're hearing in your community, in terms of vaccine reluctance, hesitancy. We're really excited to hear from Kylie because we heard you're a great communicator. So we'll turn it over now. Thank you.
All right, Kylie, move forward. Thank you.
Yeah, absolutely. Let me see. Let me get my slides up here. And then I was actually thinking, we just did a social media video of a grandparent in our community sharing her experience with measles, which sounds like it's literally right up your alley. So if I have a minute, at the end, I'll share it, but I will go ahead and start my presentation. Let's see here. Sandy or someone, will you give me a thumbs up if you can see what I'm sharing? Okay, great, wonderful. Okay, so Sandy asked if I would come in and just share with all of you updates on immunization coverage in North Dakota. For those of you who maybe don't follow this super closely or who don't follow this at all, maybe this will be eye-opening to you about how we're doing in North Dakota. Hope to talk a little bit about some trends, some gaps, and maybe some opportunities as well. So we are going to start with infant immunization, right? So for our littlest humans, this is a really busy slide. It shows all of our infant immunization rates for 19 to 35-month-olds. The big takeaway from this slide is really just to show all of you over the last 3 years, we have seen a decline in our infant immunization rates. It's not drastic, but it doesn't have to be to make an impact on immunization rates and community immunity. So if we go back, and I'm going to break this out into a couple of different graphs for you. If we go back to Q1 of 2023 and the end of Q4 2025, on average, most vaccines declined by about 3 to 5 percentage points, which is pretty significant, especially when you're thinking about things like herd immunity from measles and how small dips in coverage can really impact that herd immunity threshold and the protection for those who can't be protected. So I'm going to pull a couple of these out for you just for awareness. So the first one I'm going to pull out is the 4313314 immunization series. If you don't know what that means, that's okay. It's really a cumulative number that shows which children are up to date on multiple routine vaccines. So to be up to date with this, you have to have, it says at the bottom here, 4 DTaP, 3 polio, 1 MMR, etc. And you have to have it when they run the numbers for 19 to 35-month-olds. So what we see here is in that 3-year period of data that I'm showing you that's most recent, we've dropped that rate almost 5 percentage points in North Dakota. So it indicates that fewer children are fully protected against a lot of these really serious vaccine-preventable diseases. But the other thing is they're vulnerable during their most vulnerable time period, right? So we know our littles are the most at risk for severe illness from many diseases. And so this is really concerning from a balcony, a 30,000-foot view, but also if you look at individual vaccines. So I'm going to pull out measles here specifically. We see that our measles immunization rates are in decline, which we know is going to lead to more outbreaks. So for years, we didn't see measles in North Dakota. We were able to maintain fairly strong MMR vaccination rates, but that protection has just been slipping away quarter after quarter, individual by individual. Declining MMR coverage in young children, it's creating those pockets of under-vaccination, which means vulnerability. And we're seeing measles. We're seeing a lot of it around the globe. We're seeing a lot of it in the United States. It's really only a matter of time before that highly infectious disease finds its way into North Dakota, finds that little pocket of under-vaccination and then spreads, which is what we're seeing here today. These recent outbreaks are absolutely a clear warning. So if low vaccination rates persist, North Dakota, we face a real risk of just this continuation of additional measles outbreaks like we're experiencing right now in Northeast North Dakota. So to go to the graph here, for 19 to 35-month-olds, we've seen about a 3 percentage point decrease in vaccination rates for our young children. If we look at the hepatitis B birth dose, I'll be very honest with you. I was actually really surprised when I pulled this data. I thought for sure we would be seeing really steep declines in our hepatitis B birth dose vaccination rates. We actually don't see that over the last 3 years. I would love for these rates to be higher. So about 70% of kids get that first dose of hepatitis B vaccine within a day of their birth, and about 80% get it within 3 days. Like I said, I'd love for it to be higher, but we actually haven't seen really steep declines in that over the past 3 years, which is maybe promising, and I hope that continues. When we move to school immunization rates, school immunization rates are a great comparator. All states have school immunization requirements. All of them report those levels to the CDC, so we can really see how we're doing nationally compared to other states. What I don't love seeing is that North Dakota, over the last few years, these last 5 years, we've really been declining in our school vaccination rate. So currently, about 90% of kindergartners are fully vaccinated against measles, but we know we need 95% vaccine coverage to prevent outbreaks of that disease. And so we're below that threshold. We were really close to 95% back in the 2019-2020 school year. I think COVID has really impacted vaccine confidence in the state and parents' willingness to get their children vaccinated. We've just seen a slow decline since then. So we certainly have some work to do with our school vaccination rates. But one thing that's really hindering us is our really high kindergarten exemption rate. So in North Dakota, about 7% of our kindergartners have an immunization exemption. Almost all of those are personal belief exemptions. So either parents filing a religious or a philosophical exemption to vaccination. When I tell you I need 95% of my kindergartners vaccinated, I can't get to 95% with a 7% exemption rate. So we're below that herd immunity threshold just with exemptions as they are. North Dakota has a higher immunization exemption rate than most states. So compared to the United States as a whole, we're about 2 times higher. The US average is about 3.6% immunization exemption rate. Ours is, like I said, about 7%. So about 2 times higher. Again, it's non-medical exemptions. We actually rank 8th in terms of states with the highest level of exemption. So we reached 7% last year. We don't have data for this year quite yet, but only 7 states report higher exemption rates than us. In North Dakota, it's also really easy to get an exemption. So all parents have to do is sign the form and claim the exemption, and their child is able to attend school. So our exemption rates being high definitely affects our ability to achieve herd immunity. One thing that I did want to point out, though, is, and this is for all immunizations, but school immunizations is the example I'm going to give here, excuse me. Immunization rates vary greatly by the community that you live in, by the school you attend, by the county you live in, etc. So in North Dakota, this is our kindergarten MMR immunization rate map by county. If you look up in Northeast North Dakota, the dark blue, that's our counties with the highest immunization rates. As you get into the lighter blue, they're lower immunization rates, and then the dark gray black are our lowest immunization rates. Interestingly, I was talking to someone yesterday about this. Our measles outbreak right now in North Dakota is happening in this pocket of the state up in Northeast North Dakota, where we have the highest vaccination rates, about 95%, maybe even higher in some of those counties and some of those schools. So imagine what this situation could look like if we didn't have a 95% vaccination rate. We're at 14 cases in the state last time I looked. I think all of those except one are in that little pocket of the state. So we should feel fortunate that those counties have such high vaccination rates. But like I said, measles, it's just so impressive how it's able to find those small pockets of under vaccination or unvaccination and cause outbreaks in those communities. And unfortunately, even in a few people who've been vaccinated. So the point of this slide really is that vaccination rates vary by area of the state. In terms of adolescents, when I was pulling this data, adolescent rates are actually holding fairly steady in North Dakota over the last 3 years, but I don't want to cause any caution, but obviously it's something we're watching really closely. Our HPV initiation and completion rates are fairly steady. Completion rates have declined just a little bit over the last 3 years, but our meningococcal vaccines are holding steady, as are Tdap and varicella. In terms of adult immunization rates, Sandy asked that I would pick out just a few that some of you might find interesting. So shingles vaccine, that coverage is increasing slowly. About half of adults have started that series. but many are still unprotected, which, if we could increase that uptake and completion, we could significantly reduce shingles, which is preventable, and also those long-term complications of shingles, which we know are really terrible. Let's see here if I can advance my slide. Here we go. RSV vaccine uptake, early progress, but definitely gaps remaining. So this is a fairly new vaccine for our older population, only coming out in the late 2023 year. Only about 33% of our oldest population has received that vaccine so far, much lower than we'd like it to be, but it's a start. If you look at that 60 to 74-year-old age group, that vaccine is only recommended for those at high risk, but just under 15% of our North Dakota adults of that age have received that vaccine. Significant gaps here, opportunities for growth, right? And preventing RSV-related hospitalization and severe disease in that population is our goal. And so I think as that vaccine is around a little bit longer, we'll continue to see growth in those areas, but certainly an opportunity to prevent more severe disease. In terms of pneumococcal vaccination for adults, we do actually okay. About 60% of our adults age 65 plus are vaccinated, but much lower coverage in that 50 to 64-year-old age group. So again, opportunities there for providers to be having conversations and for adults to be protected against severe disease caused by pneumococcus. All right, last but not least, we're going to talk about seasonal vaccination, especially influenza. So we in North Dakota have seen all of our age groups impacted and vaccine uptake getting lower and lower as we move on from COVID, which is really unfortunate. So it's declined across all age groups over the last 5 years. The largest drop really has been in that 6-month to 4-year-old age group. We don't see as much of a decline in our older population. So this light blue line at the top here is our 65 plus age group. We have seen, a few percentage points where it's decreased there, but nothing like we'll see in the younger population on the next slide. Let's see here. So our pediatric flu vaccine coverage, vaccination rates in our youngest population, so that 6 months to 4-year-old age group, the one that we know is most vulnerable, it's decreased 27% in just 5 years. If I was to pull in data from the 2021 season or the 2019-2020 season, we'd probably be looking at almost a 30 or 40% decrease. It was really, really high going into COVID. We were able to vaccinate a lot of our youngest population, and we've seen pretty significant drop-offs since the COVID, since the onset and then moving on from the COVID pandemic. So we certainly have lost some ground and certainly know that we're continuing to see the impacts of that in our communities. So this year, North Dakota, I believe, has reported at least 2 pediatric deaths from influenza. It might even be 3. Don't quote me on that, but those are the first deaths that we've seen from influenza in many, many years. We talked about the measles outbreak a little bit. We're up to 14 cases. Some of them have been hospitalized. I think it's really easy for us to look at these numbers that I just presented to you and think about, only 88% of kids are vaccinated or whatever the number might be. But I think what we have to remember behind those numbers is that these are kids. These are, someone's child, someone's niece, someone's nephew, someone's grandchild. And some of them are suffering unnecessarily from diseases that could absolutely be prevented. And it just absolutely breaks my heart as somebody who does this for a living, to know that there are still people who are suffering from vaccine preventable diseases. So I'm just really excited about Grandparents for Vaccines and the work that hopefully they can do in North Dakota to try and increase some of these rates. I did want to just point out my last few slides here. All of the rates that I shared today are publicly available on the state website, the state health department website. So if you're really into data and you want to learn more about this, this is the coverage rate website. The URL is down here on the bottom. I'm happy to share my slides, but please go check those out, dig into them, and try and digest them. Our center does have a number of vaccine videos, vaccine educational videos. If any of you are interested in them, they are definitely targeted towards healthcare providers, but certainly probably some tidbits that the general public could pick up as well. So I just wanted to call that out. And then we do have a monthly webinar series. If any of you are really interested in these topics, our monthly webinar is actually happening right now. It just happened to cross over with this one. So my team's over on our monthly webinar, but our webinar topic today is shared clinical decision making and kind of all of the implications of that. That have been handed down over the last few months. So if any of you are interested, there's a couple URLs here. Like I said, I'm happy to share my slides. So Sandy, maybe I'm happy to stay on and answer questions. I'm sure there might be some for the grandparents for vaccines folks as well, but thanks for inviting me, and yeah, happy to stay on and answer questions.
Thank you. I think that was a perfect pair with introduction for grandparents for vaccines, but also just so people can kind of understand what's happening in the state with immunization coverage. And then the opportunities at NDSU where you can learn more about vaccines and increase your vaccine knowledge if you want to kind of dig into it and be able to share that out. And Mary, I don't see any questions, but there's still time if anyone wants to have questions. I can tell you next steps from the foundation's perspective. We are going to reach out to the people that are interested in attending this webinar and or have signed up with grandparents for vaccines nationally, and start conducting monthly meetings for a state chapter with people that are interested in joining the chapter, and then also handing off leadership to whoever people elect within this chapter within North Dakota. We can have different regions, leaders for different regions. We're just going to grow the chapter as much as we can so we can get the information out and give support to communities for vaccine preventable disease and maintain access. So any questions so far? Okay, Mary. Sorry, Mary. Why don't you finish
I have one
up?
question. Yeah, I just have one question because I really, when I was looking at the Get Involved page from Grandparents for Vaccines, there's just a lot of things that you can do within the communities, and I was just wondering if you could kind of talk about, some things, like the book club or some of those different things that are happening, and what is like, just kind of share about that experience.
Donna, do you want to talk about it from the event?
Sure. Some of the most of the events that we've had so far are sharing the word about grandparents for vaccines with other organizations, so smaller groups. We're going to be in Arizona in April, speaking to a large group of individuals who are very much involved in vaccines in Arizona. And so we, that again is promoting, who we are, what we're doing. And we're going to be talking a little bit more about why storytelling is such a profound and effective tool. We'll also be talking about the different things that we can do. The other partners that we are suggesting is working with bookstores and with libraries to be able to bring home that whole idea is that there are incredible stories that are in children's books about vaccines, and not just a book that talks about, this is a vaccine and this is how it works, but rich stories that include a character who has been subjected to different kinds of illnesses that could have been prevented. So we are beginning to work on that. We haven't had any book clubs yet, although we have a lot of information about the books on the website. And if anybody wanted to take a try at that, we can. I've used children's literature in my practice for many years, so we would certainly be able to help you with that. And we also might want to reach out to publishers to see if they might be interested in supporting our book clubs and book groups. But again, libraries and school libraries, as well as bookstores, are very effective. So this first 6 months, our events have been really about spreading the word. And then we're hearing from our members in each of the states what they're doing individually. Teri, do you want to fill them in about what's going on in New Jersey?
Oh, yes. Well, I have 4 things besides New Jersey, but one is one of our state leaders in Iowa was invited to her church, and we want to keep religion out of the conversation. So a pastor, I guess, gave a prayer, and then she sent the video of her with 2 parents, and it was in the library of the church, and no religions thing came up. But they did a Q&A with her to share with the young parishioners in their church about vaccines. And it was excellent. Like they had a lot of questions about how to reassure your child, how to tell your child, when they're getting a vaccine so they don't get hysterical, how to reward your child afterwards, without overdoing it. What is a vaccine? And the video was amazing. So that was one thing. Another thing that somebody did down in Florida is they do videos in their church and they have somebody who has that expertise. And so they actually set up a little stand after church and interviewed grandparents. And they did like just 1 minute videos of a short little story that they remembered during their childhood or young adulthood about vaccines. And these videos most of them are going into the shorts of the YouTube channel, and they are really great. And then another down in Florida still, because they have several state leaders, they're already getting ready to go to senior community centers, where the living facilities, where there's 1,000 grandparents that live there. And Donna has been wonderful. She's put together a whole presenter guide. And we also have PowerPoints that are available that are a little different than the one we showed today, but we can send those to you via WeTransfer. So that way you have background on how you might do a presentation. We also recently did a letter to the editor writing workshop, and we taught a lot of our state leaders how to write letters to the editor. And already 3 of them have written those letters. So, and that was just less than a week ago. So we feel that that's another way of getting out the word. And then in New Jersey, that's where our new executive director lives, and we have some great leaders there. And they're also launching into, and I never say it right. You can help me, Donna, but is it Nacho? Nacho?
Nacho.
Nacho. Yeah,
Almost like nacho.
yeah, they're getting into their state chapters of that, and they're having them do some presentations. So there's all kinds of things happening, no shortage of that. But of course, we want a lot more, and especially in North Dakota.
Wow, thank you for sharing that. That's just amazing work that's being done. So I don't see any other questions in the chat.
I have a
So,
question. Yeah,
yeah.
I want to hear. I wish we could see the people that were here today. I know that's hard, might be hard to do, but I'd love to hear some of the things that you're hearing in your own community. Like, what is it that you're hearing that is a parent's biggest concern and reluctance over vaccines? So that would help us shape our message. Anybody?
I'll maybe add one.
Oh,
That
many
when
questions at one time.
Oh, I see Jordan put in the chat too here, like too many vaccines at one time. I'll just have people ask me like, is measles even that bad? Like, what does it even do? I think well, again, like they're not in we have no reference for what measles does or how it affects people or how serious it can be. And so that's just a question people have is what does it do? Polio too, I would say is probably another one.
We had another comment, fear of vaccine side effects. Thank
Yeah,
you.
that was one thing that was really interesting to me. I actually was the medical lead for the second largest county in Oregon, for the BIPOC clinics. And we talked a lot about the difference between side effects and adverse effects before we went in and talked to the parents and the public. And there are huge differences between the two. And I know teaching nursing, we always identified that, although a lot of physicians beg to differ. They think it's all kind of lumped as the same. But a side effect is really like something that's normal, it's expected, it's a good thing. It means your immune system is responding in some way, but they go away really fast. They're very easy to take care of. Things like your arm hurts or your child might have a little fever. But the adverse effect, like for the measles vaccine, I looked that up. It was 1 or 2 per million doses. And when you compare that then to the odds of the child getting encephalitis, 1 in 1,000, getting pneumonia, 1 in 20, dying, 1 in 1,000, and you look at 1 or 2 per million, it's like the risk benefit. And I don't know that I would try to convince the parent if I was talking to him, but I would definitely share that information, impart that, and they can definitely look that up too and do their own research. But there's a lot of odds involved there. And I definitely agree, the schedule. Your local epidemiologist, Caitlin Jetelina, just published something. She said to avoid that word whenever possible. Don't use the word schedule. I know this probably is not like the best example to use with parents, but if you take your kid in for allergy testing, they usually do a lot of different allergens, antigens at the same time. And, you know, parents will do that. And I just wonder, like, in their mind, what do they see as the difference? Is it that are they thinking about the number of pokes that the baby is getting? Or is it the fact that vaccines are mixed, that there's like three vaccines or 4 or 5 vaccines in one injection? I don't know. I find that interesting too.
That is really interesting. My daughter did have allergy testing, and so when I think about that, yeah, there's a lot of pokes with that. So a couple more things that have come in. Misinformation, not trusting the government. They don't know who is reputable. Someone asked me yesterday why we don't have chickenpox parties anymore. Um, General mistrust in vaccines due to how fast the COVID vaccine came out. Listening to the influencers and podcasters who are not educated on vaccines and medicine and research, taking more of a holistic approach. Let's see, we got. Okay, so a school nurse and also children hospital nurse. In the school settings, exemptions are extremely easy in the state, not trusting medical and not having the proper evidence. One example I've heard from parents is the reason for the decline or near eradication of disease wasn't because of vaccines, it was due to improved hygiene and sanitation. Okay.
Okay.
Well, hand washing is a good thing. I will never not promote hand washing.
Right?
Yeah.
That is good. But, in terms of the sanitation, Oregon just tested the wastewater in Oregon, and that's how they determined that measles is really skyrocketing in our state. So I don't know. I mean, I don't think that probably I mean, it doesn't really have any scientific evidence that works.
Yeah. Well,
And
oh, go
didn't,
ahead.
oh, I'm sorry. I don't know what it was like in the 50s, Donna, do we know, like, what was the sanitation like then? Didn't we have clean water to drink and, wasn't,
Yeah. I think there's probably some literature, and I can dig into this because that's a very interesting take. As a matter of fact, a lot of the comments were very individual focused. I can wash my hands. I can prevent this. I can eat healthy. I don't need them to tell me what to do. So it's that sort of that sense of, I've got this under control in my own life. However, when you think about the what happens with the measles outbreaks, you could wash your hands from now until the cows come home, and it's in the air. It's unless you have that taken care of. But the other thing that people that are looking at this from a very individual standpoint, but think about today's young families. Maybe both parents are working. Kids have all kinds of activities in schools and responsibilities at home. And um, once you start, as we have seen in South Carolina, once you begin with quarantining and closing schools, you are now impacting a family's daily life. And I can remember as a kid, when measles and chickenpox were rampant, it would come into a school, it would come into a classroom. My brother would get it, then I would get it, and my mom would be at home with quarantined kids for 2 weeks for my brother and then 2 weeks for me. Now the schools are closing. So we don't often talk about the social value of getting vaccinated, but in fact, we are protecting our neighbors as well, and not just neighbors' children. We're protecting neighbors who may have immune compromised diseases or older generations that really are struggling with their own health. And for them to get one of these communicable diseases because the levels are, there's no more herd immunity, then we are not doing, we talk about Mr. Rogers, look for the helpers, it's all about our neighbors. We're not really taking care of our neighbors as well. And that story hasn't been told enough, but that's one of the things that we're working on as well.
Wonderful. Thank you everyone for the comments in the chat. This was a great discussion. And thank you to Donna, Teri, and Kylie for being here today, and to all the attendees. To stay connected with us, you can follow Healthy NODAC on Facebook, Instagram, Twitter, and Foundation for Healthy North Dakota on LinkedIn. Also, visit the link to join the coalition. And if you can, scan the QR code to take the evaluation survey. However, it will be emailed out as well with the recording. So thank you, everyone, and have a great rest of your day.
Thank you.
Thank you.
Thanks so much.